Bruce Hamblin considers himself to be a lucky man. One day, his wife Claudia, who is a registered nurse, noticed Bruce was acting disoriented. She took him to an emergency room immediately.
On the day that my wife took me to the ER, I had just gotten back from a haircut, and I didn't think that I had any symptoms at all, but obviously my wife, being a nurse, she's pretty adamant that I should go to the hospital and have this checked out, and I said, that's fine. I'll follow you, whatever you say.
We didn't really know Bruce's diagnosis. He had some difficulty seeing, some dizziness, and a CT scan was performed suggesting he might have a tangle of abnormal blood vessels. He had an MRI the next day that confirmed the dural fistula and also showed that it had caused a small stroke. Thankfully, Bruce made a complete recovery from the stroke. The dural fistula had certainly announced itself, but we still had the opportunity to repair it, to fix it, so it couldn't cause any more strokes.
Well, if I didn't take action right away, that could bleed, and I could die real quickly. And they said, in fact, one of the doctors said they usually only see this procedure when they do an autopsy.
When we received the diagnosis, I fell apart. I later on did some investigating on my own. I talked to some of the nurses, and they told me that he was in the best hands with Dr. Malish and Dr. Bovis, and we're right.
We can offer open surgery, opening the skull and physically removing the abnormal blood vessels. We can offer gamma knife radiation therapy or radiosurgery. We can offer embolization, steering a very small tube through the blood vessels up to the fistula and injecting materials to block off the fistula. In Bruce's case, it required a combination therapy. Dr. Bovis, Dr. Sweeney performed the gamma knife radiosurgery, and then my team performed the embolization procedure, which offered more rapid protection from any further strokes.
One thing that is very important about the team approach here at Alexian Brothers is that it allows us to really listen to the patient. And by listening to the patient, we can present them all of their options of care, and they can select the option that they are most comfortable with. In this case, it was gamma knife with the Perfection unit.
The Alexian Brothers recently installed the Perfection Gamma Knife, the latest generation in minimally invasive cranial radiosurgery, at the Illinois Gamma Knife Center, located on the campus of Alexian Brothers Medical Center.
We're clearly in the upper range of Gamma Knife centers in terms of the number of patients we treat per year. We've been open since 2005, and we average anywhere between 180 and 200 or 205 patients per year.
The new Perfection system offers a number of advantages from the previous system and from other systems. Firstly, it has a limitless potential for treating lesions in the brain, just like Bruce's, but other lesions as well. It has an ability to treat multiple other tumors and abnormalities. Secondly, it is extremely comfortable for patients to have the gamma knife procedure performed on the Perfection. And then thirdly, it's much safer than other devices because it allows for a lower dose of radiation given to the rest of the body. What happens with a typical gamma knife procedure is that a patient comes into the Gamma Knife Center, we apply a head frame to their scalp, we then send the patient for data acquisition, which usually means an MRI, an angiogram, or a CAT scan. We then take all that information, we program that into a computer, finding the abnormality with a great deal of accuracy. We select our dosages. We then plan on proceeding with the treatment by having the patient lie in the gamma knife machine and then target the abnormality with highly focused beams of radiation. Well, the reason we chose gamma knife first, prior to embolization, has to do with the ability to visualize the abnormality. Afterwards, we treat this abnormality with embolization material, which completely shuts it down.
The embolization procedure does not require open surgery. It's performed here in the neurobiplane angiography suite. Because we don't have to open the skull, there's no trauma to the skull, there's no trauma to the brain, and these patients usually go home to return to their previous activities in 2 days.
So we treat with gamma knife first, so we can see the abnormality. It takes a year or two before gamma knife starts working, and in those 1 or 2 years, the AVM can still potentially rupture. So we treat it with embolization, which works acutely, but may not work in the long term.
When Bruce came to this hospital, the physicians from all three disciplines met and discussed his case, reviewing not only the individual treatment options, but the various combinations of treatment options. This communication and this teamwork is one reason that Alexian Brothers was the first program in the Chicago region to be certified by Joint Commission as a comprehensive stroke center. Bruce did beautifully. He continues to follow up with Dr. Bovis, and he has not had any further strokes since his treatment.
He is doing great, and I'm putting him back to work, and we are both very, very satisfied with the procedure that was done and that he was able to avoid brain surgery.
Dr. Bovis and Dr. Malish were both instrumental in my care, and I think that they're probably the best doctors that are available. I'd put my trust in them. I'd tell everybody else, go ahead and see them if you have a problem.